Hi, it's Dr. Jon Perlman, Beverly Hills plastic surgeon, and I want to welcome you to this first edition of Ask Dr. Perlman. I've asked patients and friends to email me and send me questions on Facebook just to give them some information about plastic surgery. A lot of people are curious but don't really know the nitty-gritty about these procedures, and I'd like to help. It's something many people consider, many people are curious about. Some people don't have any interest in it but may still be curious to find out what it can do. So let's begin. My first question comes from Isabel, and it's, how can I look fresher and younger and less tired looking? Well, the answer to that, Isabel, depends upon exactly what's the cause of the change in your appearance. Are you not sleeping well? Have you lost a lot of weight? Have you had years of sun damage? Is your skin wrinkled and freckled? Or is your face becoming hollow and the tear trough area looking depleted? There are so many wonderful techniques now in plastic surgery that don't require surgery, such as the use of light chemical peels, medium chemical peels, laser peels that have quick recoveries compared to the old days. There's also fillers and Botox. You know, Botox is fabulous for wrinkles around the eyes, between the brows, the furrow or frown lines, as well as for the forehead wrinkles. We can also use Botox to lift the corner of the mouth, help muscle bands in the neck. So there's a great deal of potential available to you without requiring a surgical procedure. Also, a lot of patients ask for filler. They want their lips to be plump, maybe the way they were when they were in their teens and 20s. Or they need to highlight their cheekbones because they've lost some of the volume in their face with aging as they got into their 30s or 40s. There's a lot of great potential. Also, softening the nasolabial lines with filler can really help. But one of my favorites has to be accentuating the cheekbones, bringing the prominence back. It restores such a youthful look. Number two is a question from Jen. She's considering having breast augmentation surgery. What's the difference between saline and silicone, and which would I recommend? Well, of course, it's a personal decision that everyone has to discuss with their plastic surgeon, but it's, I think, rather important. There was a period of about 10 years where the FDA required us to use saline implants, so we got a lot of experience with them. They'd been used maybe 25, 30 years ago, but had problems with a lot of deflations. So basically, saline implants is a saltwater solution, and you're putting in a bag of water. If your breast tissue is thick and your skin elasticity is good, I cannot tell the difference between saline and silicone. But if your breast tissue is thin, perhaps because you've had kids or you've lost weight or you've just never had much tissue and good skin elasticity, then saline implants can really feel exactly like a bag of water and be prone toward visible waviness or palpable rippling. And they can just feel like a bag of water. So my inclination is to recommend for most patients that they first consider the use of silicone gel implants. The current ones are cohesive. If you cut it in half, it doesn't ooze out like the old ones. So they're not perfect, but I think they're awfully safe and what I would generally recommend. There is a halfway choice between the two. There's a new implant called the Ideal Saline Implant, which has the shape of a silicone implant, has baffles inside, and feels much closer to, but not identical to, a silicone implant. So that's something else for you to consider. The advantage of saline is if they ever do leak, and eventually most of them will, just over time, it deflates, your body absorbs the water, and you'll notice the difference. So that's it in a nutshell, the advantages of both types of implants, though probably we use 95% silicone implants. Let's continue. Bill and Gloria have asked me how to improve their facial shape. Well, as I alluded to earlier, there are some dramatic changes that can occur with the use of fillers or fat grafts. The most common fillers nowadays are Juvederm, Restylane, both of which are hyaluronic fillers. Some use Belotero, which is a thinner filler, doesn't last quite as long, but it's good for very superficial wrinkles. We've also got Radiesse, which is a longer lasting filler. Can't be dissolved if you don't like it, but for most people it gives about a 1-year improvement, and it's great to augment the cheekbones, maybe the chin. It's good for the nasolabial lines. So I like that. Some seek a longer result, a longer lasting result, and choose Sculptra, which builds up, it stimulates collagen. So you have to come in for a series of injections, anywhere from a minimum of 2, most likely 3, up to maybe 5 or 6, to build up the collagen in your skin or underneath your skin and add volume. And that lasts for 2 years, maybe even longer. Hyaluronic fillers, by the way, and and Radiesse are both used to rejuvenate the hands. That's another subject for another date. Okay, Helen has sent me an email through Facebook or a message asking, how do I know when I need a facelift? Well, that's a good question, but for most people, you start to see the accumulation of skin, the droopiness in the jowls. You lose some volume in the cheekbones, the nasolabial lines become more prominent, the neck can become droopy. Those are the typical signs of someone needing a facelift. Bags under the eyes indicates the need for an eyelid surgery. It can be part of a facelift, but it doesn't have to be. But once you look in the mirror and you lift and you go, wow, that looks a heck of a lot better, that's probably a time that you can start considering a facelift. Most of my facelift patients are at least in their late 40s, commonly in their 50s up through their 60s, rarely even in the 70s. Last, Sue Ann, liposuction. What can it do for me? You know what, Sue Ann? It's a fabulous procedure if you have a double layer of skin that you pinch and the padding is thick. It can be thinned in the course of a 1-hour procedure. It doesn't shrink the skin very much, maybe a tiny bit, but it takes away the padding that you can't get rid of with diet and exercise. So consider it if you've got a resistant area and you exercise and you eat reasonably healthy and you're at a reasonably good weight. But for example, the saddlebags or the hip rolls or the tummy, if you've got that pudge there, liposuction can get rid of it in a snap. Thank you for listening. I'd invite you, if you're interested, to send me your question. I'd be glad to respond to it through Facebook, where I am listed under plastic.surgery after facebook.com, or Twitter, where I'm at Dr. Jon Perlman, JONPERLMAN, and my email address, jperlmanmd@gmail.com. Thanks for listening. I look forward to hearing from you. Bye. Have a good day.